Antibiotics are effective treatments for some illnesses and infections, but other times they don't help speed up recovery.
A significant reason for that is antimicrobial resistance. Newswatch 16's Carrie Kearns explains what that means in tonight's Healthwatch 16 report.
Healthwatch 16, sponsored by UPMC, life-changing medicine.
Do you wonder about the difference between antibiotic resistance and antimicrobial resistance? Antibiotic resistance occurs when bacteria change and become less affected by antibiotics. What about the antimicrobial? Doctors at UPMC explain it.
That's just referring to any microorganism or virus's ability to learn, so to speak, how to not be killed by the medications that we've created to eradicate them.
Antimicrobial resistance can happen for several reasons, including the overprescription of antibiotics.
80% of upper respiratory tract infections, like when you have a runny nose, cough, sneeze, 80% of the time those are going to be viral in nature, meaning that antibiotics, as I mentioned, things that kill bacteria, will have no effect on treating these illnesses.
But Dr. Perry adds, sometimes patients push for those antibiotics and Z-Paks.
What happens is the doctors feel pressured a lot of the times. They end up giving the antibiotics. The patient feels better in a few days, and then they're like, yes, I was right, the antibiotic is the reason for this. But in fact, a typical viral URI will resolve within a week. So without any treatment at all, they would have had the same exact outcome.
Dr. Perry also says that azithromycin, the antibiotic found in a Z-Pak, is losing its effectiveness.
Because of overprescription of azithromycin now, that Streptococcus pneumoniae bacteria has a 30% chance of being resistant to that drug. So this not only shows the development of bacterial resistance in action, but also highlights the fact that these Z-Paks that everyone's demanding at their doctor's visits really are not that helpful.
If you plan to take leftover antibiotics from a previous prescription, it's crucial to talk with your physician to make sure the antibiotic is appropriate for your current infection and that you have enough of it at home. For this Healthwatch 16 report, Carrie Kearns, Newswatch 16.